What happens when you can't lift the foot off the floor and it drags when you walk? Hi, I am Dr. Sheetal Mundada, and in this video we are going to talk about the foot drop. A foot drop, as the name suggests, is the condition where the foot loses its strength and falls flat on the floor. If you have a foot drop, you will not able to lift the front part of the foot and it will drag on the floor while walking. The foot drop is not only the muscular condition but has a neurological origin in which the common peroneal nerve loses its function. The common peroneal nerve supplies to the muscle which is responsible to lift the front part of your foot while walking. Nerve might stop functioning due to direct injury, pinching, muscle or nerve disorder directly affecting brain or spinal cord. You might be at a risk of damaging your nerve and developing a foot drop if you have a habit of cross-leg sitting, squatting, or kneeling for a long time. Strength exercises of tibialis anterior muscle is required to get the ability of the foot to lift up. Stretching exercises are important to avoid the permanent tightening of the muscles, ligament, tendon and the skin around the ankle joint. Gait training to improve your walking is must to get back to your normal walking pattern. Braces and splint will keep the foot in the normal position and avoid the muscle tightness around the ankle. However, braces does not give the strength or a movement. I hope this video helped you to understand your foot drop. Don't forget to leave your comment to share your views and queries down in the comment section box. For more videos on neurological disorder, don't forget to subscribe to your physio.